Okay, I'll be doing my refutation on the topic of euthanasia. I'm going to start with a couple definitions. Euthanasia is the intentional killing by act or omission of a dependent human being for his or her alleged benefit. Key word being here is intentional, not to be confused with assisted suicide, which is where someone provides an individual with the information, guidance, or means to take his or her own life with the intention that they will use it for that purpose. When a physician is the one who gives them this advice, it's physician-assisted suicide. And a little bit of background information. Euthanizing people is illegal throughout the world with the exception of the Netherlands. And physician-assisted suicide is permitted in Belgium and the state of Oregon. Most commonly, they will prescribe a lethal prescription, which is usually a strong barbiturate solution, where they will take it and then eventually die. Her major claim was euthanasia has advantages for the terminally ill. Secondary claims would include euthanasia relieves unbearable pain, euthanasia provides a better quality of life for the person, and the person would die with dignity. Her first point, that euthanasia relieves pain. She suggests that the process is painless, briefly lists alternative options such as hospice care, and states the patient has a right to relieve pain. There is, however, no support for euthanasia relieves the pain. From the Oregon's Death with Dignity law, it stated that ingestion of the lethal prescription takes between 5 minutes to 48 hours to actually go into full effect and person to die. And according to WebMD, some side effects of this barbiturate are nausea, hallucinations, dizziness, anxiety, and possible seizures. With such possibilities, how can it be concluded that a painless procedure? If anything, euthanasia actually has a capability of increasing the pain for the moment before death. She also weakened the alternatives by vaguely explaining their functions. Hospice care, in more detail, is making terminal patients as comfortable as possible, empowering them with the control of the time they have left, but neither hastening or postponing their death. Therapy is used to reduce the pain, and hospice care provides patients and their families physically and psychologically for death. Her second claim was that the patients will have a better quality of life. She speaks about the depression that terminally ill patients encounter. First of all, this is a value claim which is loaded with emotion and doesn't fit well in the fact-based argument. And I wanted to give you guys a syllogism. If a patient is in hospice care, he and their families will be aware of death. Patients who don't enter hospice care are still eligible for euthanasia, and every decision for euthanasia isn't necessarily an informed one. So making the decision such as ending your life without proper preparation can make situations even worse for your relatives and not necessarily for yourself. And I was just curious to see how good life is when you're dead. The third claim was that they would die with dignity. She expresses the feel of empowerment over the conditions and presents statistics that show this. Her statistics are not put into context. There's no sample size, no dates, and no general background for these studies. After reviewing her sources, I found that the data was collected in 2003. And one of the statements was that 57% of patients requesting a lethal prescription cited a loss of independence as an important reason for the patient's decision. In the same study, actually, I found that in 2003 there were only 42 cases of physician-assisted suicide that were reported. 57% of 42 is 24 patients. How can it be assured that this is the overall consensus of all terminal patients? And it's a lot easier to have such high percentages with lower sample sizes. Concludingly, euthanasia is illegal in the majority of the world, and her arguments hold little grounds because of lack of proof, avoidance of alternative solutions, and the misleading statistics. We must also consider if euthanasia were to become accepted, where will the judgment of who is allowed to die end? I'll end with a quote by Dr. Herbert Hendon, who is the Executive Director of the American Suicide Foundation and Professor of Psychiatry at New York Medical College, has written the following in his analysis of euthanasia in the Netherlands. It's clear that legislation of assisted suicide and euthanasia is not the answer to the problems of people who are terminally ill. The Netherlands has moved from assisted suicide to euthanasia, from euthanasia for people who are terminally ill to euthanasia for those who are chronically ill, from euthanasia for physical illness to euthanasia for psychological distress, and from voluntary euthanasia to involuntary euthanasia. Voluntary euthanasia is where the patient gives consent, and involuntary is not such the case. The Dutch government's own commissioned research has documented that in more than 1,000 cases a year, doctors actively cause or hasten death without the patient's request. Thank you.
All right, you spent some time on the definitions, and I guess that's okay. I think it's important to note that down below, when the advocate's making some arguments, that they either failed to make to distinguish between euthanasia and assisted suicide, and therefore some of their information is going to be talking about one rather than the other. And then you need to have a little bit more explanation about why that matters in the course of those particular arguments. Your label on the secondary claims was easy to follow, no problems there. I thought there was an interesting argument about the potential pain and suffering that somebody might get being provided, you know, the barbiturates, and you have an interesting question there, and I think it's a reasonable challenge to make on that particular point. I think one of the things that gets underdeveloped is the discussion of hospice care as an alternative, and I think that you need to do a little bit more to show that it is an effective alternative that does address those issues of pain and quality of life issues that make people so concerned that they think they need to have access to physician-assisted suicide or to euthanasia. Your label on the second point was clear. You do suggest that there's a discussion of a value issue here, and you've got some kind of syllogism that you're trying to present. I didn't think that it was very clear at all. I did think that there is a good challenge toward the end that simply says, you're basically making the argument that they are begging the question, how can you have a quality of life when you're dead? That's a pretty reasonable question to be asking here, and I think that that's another place where if you had some contrasting information about what the alternatives to euthanasia were, that you'd be on a stronger ground there. A challenge to the study information on that last point and the statistics, I thought those were reasonable points to bring up. I'm not sure that they utterly undermine the advocate's claim, especially since we are talking about just the experience in Oregon, because that's the only place where it's legal and that's the only place where we'd have those numbers. The notion that the numbers are insufficient, I think, needs to be proven. If we have 56 cases that we're looking at, we're making inferences based on the statistics on those particular cases. Why are they atypical? Why would we believe that it would be somewhat different? I think you need to have an explanation of that. All right, thank you.